As healthcare workers, we experience trauma from witnessing patients' journeys and struggles. My team encourages and supports me in finding ways to cope with this trauma. For example, I use beads representing patients' birth months to remember and honor those I cared for at the end of their lives. I think acknowledging our trauma is crucial because we often put on a facade so we can do our jobs. I think it's important that we find ways to process and discuss our vicarious trauma openly and with the support of our organization or health network. We are still people in our roles in healthcare, whatever they may be. Another thing that helps me is to find ways to express my individuality within my role. Just like a patient doesn't want to be seen as any other patient, I don't want to be seen as any other nurse. I express myself through colorful hair, facial piercings, and unique badges. And because I'm allowed to do this, I feel most like myself. I can connect with patients on a human level who identify with these parts of me. I want them to see me as a fellow human, not just a healthcare provider. When patients feel they're talking to a human being rather than a medical professional, they open up. We can make real differences in their lives, and I feel more whole myself. I had a patient who had been consistently keeping their appointments with us in primary care, but kept canceling their mental health services. I sensed something was off, and so I sat down and talked to them one-on-one and brought it up. I shared that I noticed they were able to keep other appointments, but didn't seem able to keep appointments related to their mental health. I asked open-ended questions and invited them to share if there was a barrier I didn't know about. They finally opened up and talked about how when they were a child, their parents had sought mental health services, which ended with Child Protective Services being involved. Once I knew their underlying concern, we were able to make adjustments to what the visit would look like that they could have a support person with them in the room, and that the provider would operate with total transparency about under what circumstances information would have to be reported. This couldn't change the trust that was broken in the past, but it helped the patient and this provider build a relationship, and the patient was able to get the care they needed. In healthcare, sometimes policies are strict, like attending an appointment alone. But a trauma-informed approach sets you up to know when people need extra support or understanding. It's about bending the rules to ensure the patients get the help they need. Nurses, medical assistants, and CNAs often play a pivotal role in nudging healthcare practices in the right direction. Everyone at every level can engage in conversations with providers and leadership. This collective adoption of trauma-informed care fosters resilience within the healthcare team, especially during the most challenging times. I'm passionate about trauma-informed care because I've witnessed the incredible impact it has on patients. Approaching care from a trauma-informed perspective means acknowledging that we don't know everyone's backstory, but it helps us connect better and provide truly meaningful care. Embracing trauma-informed care within health systems can revolutionize the way we approach patient well-being. In so many ways, it's more than trauma-informed care, it's human-informed care. That's the care everyone deserves. By recognizing that everyone has trauma and working together, we can bridge the gap and improve and even save lives. That's the power of trauma-informed care.